Hello, welcome to Med School. Starting our lecture series with iron metabolism. Metabolism of iron in body is critical because free iron is highly toxic as free iron participates in chemical reaction which generate free radicals and that is harmful for cell. Talk about the role of the iron. Iron carries oxygen as a part of hemoglobin. This oxygen is also bound to myoglobin in muscles. Iron work is a critical element in iron-containing enzyme, including cytochrome system in mitochondria. In deficiency of iron, cell loses their capacity for electron transport and energy metabolization. Now, if we talk about the distribution of iron in the body, as iron content we'll see in milligram, in adult male 80 kg and adult female in 60 kg. Hemoglobin's quantity is around 2500 milligram in adult male, and in adult female it's around 1700 milligram. Now myoglobin and enzymes it's 500 milligram and 300 milligram respectively, and in transferrin iron is around 3 milligram in both respectively. Iron stores is around 600 to 1000 in male, 0 to 300 in females. Come to the topic. The only source of natural iron intake is food, which is divided as animal product and organic product. See, animal product actually contains good form of iron which is superior in absorption, called as heme iron, which is literally 10 to 20% absorbed. On the other hand, organic iron which we get from vegetables and fruit is a non-heme iron and it is only 1 to 2% absorbed. Most of iron absorption takes place in duodenum and proximal part of small intestine, and this process of absorption is facilitated by acidic content of stomach which maintains the iron in solution. Now, as we know, we are taking iron in two forms, heme iron and non-heme iron. Heme iron will transport to the cell with the help of heme transporter, and heme iron is in form of Fe2+. Okay, so Fe2+ will transport to the basolateral site of cell with the help of ferroportin. Now, to plasma transferrin to absorb or to bound with the iron should be in the Fe3+ form. So hephaestine will oxidize the iron to Fe2+ to Fe3+. See, on the other hand, iron is already in Fe3+, but our brush border epithelium will not absorb this iron. We need to reduce it to Fe2+ form. So ferroreductase will reduce it to Fe2+. Now the divalent metal transporter will transport it to inside the cell, where Fe2+ will transport by ferroportin to the basolateral site. Now where hephaestine will convert it to Fe3+, and plasma transferrin which bound with the Fe3+, it reached to where plasma transferrin receptor are present mostly. It reached to erythroid marrow cell. Okay, erythroid marrow activity, and other will stored as a ferritin form. Thank you, and please subscribe and like.